Nursing homes can be a last resort for many families, in part due to a mistrust that's developed over the level of care some provide.
People, they move into these places and they're terrified that they're not going to get any kind of service, that it's going to be terrible.
Carl Archer is a New Jersey-based elder care attorney advocating for families with older relatives in assisted living communities. Since the onset of COVID-19, he says business has been brisk.
When the pandemic first hit and there were a lot of inadequate infection protocols, you had a lot of people that died.
The close scrutiny on nursing homes since the pandemic began, together with staffing shortages and a lack of adequate government funding, has made it more difficult for many to keep operating. Further complicating matters, according to the Population Reference Bureau, the number of people 65 and older is expected to nearly double from 51 million in 2017 to 95 million by 2060. Data from various health authorities show there are currently more than 800,000 Americans residing in assisted living facilities and about 1.4 million in nursing homes. The majority are 65 or older. That exacerbates the challenge of meeting their needs. Most would prefer aging in place, but that can be difficult.
The reason why people are in nursing homes is because there is no reasonable alternative for them to be at home, because this person is not medically stable or because the burden on the family is too great.
Prices for nursing homes vary greatly across the country. According to one recent survey, the median annual cost for a private room is about $108,000. Assisted care can be even more expensive. This senior living community located in Hudson Yards is high-end. It features floor-to-ceiling windows, room service, physical therapy suites, even a cinema. And it's got a price tag to match. Residences range from $11,000 all the way up to $27,000 a month. However, many of the nurses at facilities all across the country say they're being underpaid. As a result, many have quit for less stressful jobs amid a still tight labor market. President Joe Biden says he wants more nurses and caregivers staffing nursing homes and has outlined a plan for more stringent procedures. However, those running and working in these facilities say the real problem is that the government isn't providing enough funding to hire the number of staff required. Archer says finding a solution isn't going to be easy, but it is imperative.
You're dealing with the most vulnerable, elderly, sick population.
Karina Mitchell, CGTN, New York.